Hello, this is Delana Brown,
And Jessica North.
and we are doing our community nursing presentation on a school nurse.
The National Association of School Nurses defines school nursing as a specialized practice of professional nursing that advances the well-being, academic success, and lifelong achievement of students. To that end, school nurses facilitate positive student responses to normal development, promote health and safety, intervene with actual and potential health problems, provide case management services, and actively collaborate with others to build student and family capacity for adaptation, self-management, self-advocacy, and learning. The primary role of the school nurse is to support student learning. The nurse accomplishes this by implementing strategies that promote student and staff health and safety. The nurse takes a leadership role in serving as the coordinator of all school health programs. As the health service expert, the school nurse serves as a health professional for the school community. Some of the services provided include illness and injury assessments and interventions, health assessments, and participation in development of individual education, plan for students with special needs, pediatric nursing procedures, such as G-tube feedings, tracheostomy care, catheterization, screenings for health factors impacting student learning, activities to promote health and prevention in teen pregnancy, sexually transmitted diseases, tobacco, alcohol, and substance use, chronic disease management and education, administering medications, crisis team participation, recommending health criteria and guidelines for school district health policies, and serving as a healthcare liaison between the school and the community. The range of school health services varies by each school district. The following health services are a minimum that should be offered according to the Academy of Pediatrics. The school nurse should give care to all students in the given school, assessment of health complaints, medication administration, and care for students with special healthcare needs, and being an advocate for the students. They need a system for managing emergencies and urgent situations, mandated health screenings, verification of immunizations, and infection of disease reporting. Identification and management of students' chronic healthcare needs that affect educational achievement. The school nurse serves as an extension of traditional community health services, ensuring continuity, compliance, and professional supervision of care with the school setting. The school nurse is responsible. So the roles of the school nurse are continually expanding. Code of ethics. School nurses have a pretty strict code of ethics. They keep in mind child well-being, diversity, excellence, innovation, integrity, leadership, and scholarship.
The school nurse works with both children and their families, so this nurse needs to be versatile when it comes to education. Each child is on its own different level of education and understanding. Special needs students pose an even greater challenge, and any education must also be provided to the parents. So the school nurse must prepare multiple ways of teaching the same material to suit the needs of each individual. This would mean that the school nurse would need to know the child and their very specific needs and level of understanding. For younger children, videos, colorful handouts, demonstrations, hands-on learning is the best way. For older students that can read and they may do well with handouts, open discussions, that would be grade level appropriate. Demonstration and hands-on learning and teach back are all good for any age level. Parents could be provided with literature and information for resources if warranted. The specific issues are different for each age range. For older children, drinking and driving, safe sex practices, information regarding puberty changes are appropriate. Education regarding these topics can be done in a myriad of ways. Schools often offer sex ed classes or health classes that discuss these topics in length and in multiple formats such as videos, literature, role play. Younger children focus might be more along the lines of safety and making good food choices. The leading cause of deaths for younger children is accidents, so the education could be about safety when crossing the road or home safety. Demonstrations work well with younger children. And with any age group, reiteration and re-education is a must to help ensure maximum retention. And parents should always be aware of what their children are learning so that they can be on the same page and the education can be reinforced at home. School nursing is recognized as a specialty nursing area and has become more clearly defined with the development of standards of practice. Additionally, school nurses might further specialize their practice with a focus on children with special needs, early childhood programs, elementary or secondary age children, adolescents, or students with high-risk behaviors. Many states require school nurse certification either through the Department of Health or national certification, which is available through a national board. And the National Association of School Nurses recommends that all school nurses have a minimum of a baccalaureate or BSN and have achieved school nurse certification. The school nurse needs expertise in pediatric, public health, and mental health nursing, and they also must possess strong health promotion assessment and referral skills. School nurses also need to have knowledge of laws in education and healthcare that impact children in the school setting. The school nurse interacts with many different disciplines and professionals. They work inside schools, so they work along with teachers, their special education teachers, physical therapists, occupational and speech therapists, any administrators, coaches, school board officials, and also the student and their parents. They interact with local health officials, any social workers, or any people that work in organizations that provide financial and service and social services. The school nurse knows very intimately the needs of each child that requires special treatments, and they interact with all disciplines involved with the child's care. They need considerable knowledge of medical disorders and treatment, knowledge of child and growth development, knowledge of working with public health problems and procedures for treatment in coordination with other health and social service agencies, working knowledge of federal, state, and local laws, regulations affecting the delivery of school health services, and they also need some knowledge of school organization and the community that they serve in. They need to be able to identify any abnormal growth and development problems, any symptoms of diseases, and be able to coordinate and facilitate services between the school and local health agencies and community resources. They need to develop and maintain health records on students and keep positive working relationships with all involved. So something I found very interesting, growing up, I didn't see the school nurse very much. I only saw her when I got sick. So doing this project, I really was opened up to exactly how much the school nurse does. They are very truly involved in every aspect of care for this child. Associations that we used for this project that we found to be very good references are the National Association of School Nurses, American Public Health Association, the School Nurse Section, American School Health Association School Nurse Section, and National Association of Pediatric Nurse Associates and Practitioners. These are our references. Thank you.
So in conclusion, school nurses play an essential role in keeping children healthy, safe, and ready to learn. The school nurse is a member of a unique discipline of professional nursing and is often the sole healthcare provider in the academic setting. 21st century school nurse practice is student-centered, occurring within the context of the student's family and school community. It is essential that all students have access to full-time school nurses all day, every day. Thank you.